Hello, everyone. Welcome to the Toronto Notes QE1 High Yield Review. This playlist is for pediatric topics in Toronto Notes, and we're starting with the first topic, which is primary care for pediatrics. Um, so again, I make this playlist off of Toronto Notes for you to be able to prepare for the Q1 exam. And this just makes it easy, whether you're driving or you're just working on something and you just want to keep studying. You just put on this playlist and you're reviewing all of the topics in Toronto Notes. So let's get into it. The pediatric primary care visit. So an overview of the visit will include a review of the schedule of well child visits. So kids visit the physician at any time, but there's a schedule for well child visits. And in the Toronto note, it's described as first, well child visits is for the newborn within 48 to 72 hours post discharge from the hospital after birth. And then in 2 months, at 2 months of age, the fourth month of age, 6, 9, 12, and 18 months. So again, when they're just born within 48 to 72 hours post birth or post discharge from the hospital, at 2 months of age. So 2, 4, 6, then every 3 months. So that's 9 and 12. And then every 6 months, that's at 18 months. Then once they are between 2 years to 5 years of age, they have to visit for their well child visit every year, once every year. Then, when they're 6 to 18 years, it's still recommended that they do a well child visit annually, but you can also they can also come every 2 years. So that's it for schedule of well child visit. Now, what are the content of these well child visits? As outlined in Toronto notes. The history and physical exam is important. And for history and physical exam, you want to explore their growth, their development or school. You want to explore their sleep. You also want to screen have dental screening and vision screening, as well as explore their nutrition. When they are adolescents, you must remember to collect a social history, and we use the acronym HEADS or SHADES for you to remember to um, explore every aspect of their social history. Then you provide them with routine immunization that is due for their age when they come in. And you also provide counseling and anticipatory guidance. So let's go into history. What's covered in the history? So, what's a standard pediatric history? For standard pediatric history, you use the acronym BINDS. BINDS. So, that's B for birth, I for immunization, N for nutrition, D for development, and S for social history. So for the birth history, you want to explore the obstetric history, especially when they're newborns and infants, you're seeing them first time post birth. You want to collect information on prenatal or pregnancy history. So that is how were they conceived? What's the mother's pregnancy history? How many pregnancies has the mother had? How many abortions, living children, dead children, and all of that? Then you go on to screening done during the pregnancy period. Were there complications during the pregnancy period? Were there ultrasounds, and what did those ultrasounds reveal? What medications were taken during pregnancy, including iron, vitamins? Where was the child exposed to smoking, alcohol during pregnancy? And you also want to screen the mother for her mental health. So that's the obstetric history that you collect when you see the child for the first time. It's also important to explore the labor and delivery history. Were there any labor complications like prolonged premature rupture of membranes, prolonged labor? Were there maternal fever, fetal tachycardia, and all of that? Type of delivery, was it a spontaneous vaginal delivery? Were interventions required, such as cesarean section? Were there medications used during labor? And then neonatal history. If you're seeing the child at birth, what was the gestational age? at which the child was delivered, and what was the birth weight, the head circumference, the length, what was the ABGA score at delivery? Did the child need resuscitation? How long was the child on admission for after birth? Then you also want to explore were there any neonatal complications like prematurity, respiratory distress, jaundice, any infection in the neonatal period, any hypoglycemia, and all of those things that help you to understand what happened immediately post birth. um then you collect past medical history for the child. So have there been hospitalization since birth, any ED visits, surgeries, chronic illnesses, accidents, injuries, and all of that. You also want to explore medications, allergies, and immunizations. So you're seeing the child today, what immunizations um has the child gotten so far? Then, of course, you move on to the D, which is the developmental history. So you review the developmental milestones and you check for behavioral concerns, school or educational concerns. Then for nutrition history, that's NBIND. For the nutritional history, you check for what's the child currently taking. The child is an infant. Is the child being breastfed currently? Or is it being fed with formula? Check for cow's milk intake. There's a maximum amount for cow's milk intake. We'll do another video on cow's milk, but you also want to check for nutritional history. Is the child taking solids, or is there a variety in the child's diet? Are they taking iron-rich foods? And you also want to explore, this is very important, food insecurity at home. Then um, the other aspects of the history to explore is family history, and then you go on to the social history. So for adolescents, like we said before, you use heads or shades to collect history for adolescents. But generally, you want to explore who lives at home, the mom, the father, the stepdad, stepmom, who and the siblings who lives at home with the child. Does the child attend daycare or school? Who are the primary caregivers? How's the child doing at school? Does the child have friends? What are the activities that child is involved with outside of school? Is there safety at home? And what are like the income, transportation, home, educational level of the caregivers. So you explore this social history, and that's the standard pediatric history. Now, just to make sure that we've covered everything that we need to cover and that you remember the standard pediatric history, I'll do a few practice questions with you. So, the first practice question is: a healthy 4-month-old infant presents for a routine well child visit. The parents have no concerns. Which of the following is the most appropriate component of this visit? I want you to pause the video here and pick an answer. Okay, the answer is B. Healthy 4-month-old infant. So we assess the growth, development, nutrition, sleep, and vision. C is not correct because you do the head screening for adolescents. D is obviously not correct because the child isn't in school yet. And E, perform annual screening only if symptoms are present, but for you do screening at all well child visits. So that's why that's not correct. So moving on to question 2. A 7-year-old child presents with recurrent abdominal pain. So note the age of the child and the history of presenting complaints. You're taking a comprehensive pediatric history. What framework is most appropriate for ensuring that the major domains of the child's history are covered? For this one, you can also pause and pick an answer. Okay, so the answer here is A, OPQRSTU. So that's something that you use to explore history of presenting complaints. BINDS helps you to helps you to take a comprehensive pediatric history. So that's birth, immunization, nutrition, development, and social history. The GTPAL helps you to explore the mother's obstetric history. So gravida what, how many children have been brought to term, how many pregnancies, how many abortions, how many live births. ABGA score is, of course, ABGA score at birth. Then head score is for the adolescent social history. Next question. A newborn is being assessed during a primary care visit. Which of the following is most important to specifically include in the obstetric and neonatal history? So pause the video and pick an answer. A newborn. So the answer here is obviously C, ABGA scores and gestational age at birth. Of course, you're not screening a newborn for adolescent substance use screening. Question 4. A 7-year-old child presents with recurrent abdominal pain. You're taking a comprehensive pediatric history. What framework is most appropriate for ensuring that the major domains of the child's history are covered? You can pause and pick an answer. So the answer here is B, BINDS. So it would help you to cover the birth history, immunization, nutrition, development, and social history. You use the OPQRSTU for history of presenting complaints. Last question here. A 15-year-old presents for an annual health visit accompanied by a parent. The adolescent appears healthy and has no specific complaints. What approach is most appropriate for assessing this adolescent's social history? Of course, the answer here is B. We said this over the period of this video. So you use heads or shades to help you to understand, explore all aspects of the social history. If you liked this video, please like the video and add the playlist to your YouTube so you can find all of the other Toronto Notes video, Toronto Notes topics on pediatrics. And I'll see you in the next one.